Hello, welcome to part 2 of 2023 PSC Physiotherapy Scientific Assistant Exam. Now let's move to question number 21. The intrinsic plus position indicates the following except option A, flexion of the metacarpal phalangeal joints, option B, the ulnar nerve palsy, option C, extension of interphalangeal joints, option D, contraction of intrinsic muscle. And the answer is option B, ulnar nerve palsy. Now let's move to question number 22. Osteoarthritis of temporomandibular joint is associated with option A, reciprocal click, option B, bilateral presentation, option C, repeated minor trauma, option D, normal mouth opening. And the answer is option C, repeated minor trauma. Now let's move to question number 23. Transverse spreading of the forefoot is referred to as option A, pes plantus, option B, splay foot, option C, plano valgus, option D, rocker foot. And the answer is option B, splay foot. Now let's move to question number 24. Gait initiation begins with option A, activation of the tibialis anterior and vastus lateralis, option B, activation of gastrocnemius, option C, inhibition of tibialis anterior, option D, activation of gluteus. And the answer is option A, activation of tibialis anterior and vastus lateralis. Now let's move to question number 25. Schober's test is done to option A, assess hip flexion contracture, option B, assess tensor fascia lata, option C, measure lumbar spine flexion, option D, measure lateral flexion. And the answer is option C, measure lumbar spine flexion. Now let's move to question number 26. The gait control theory of pain was proposed by Melzack and Wall in option A, 1970, option B, 1975, option C, 1965, option D, 1960. And the answer is option C, 1965. Now let's move to question number 27. The method of application of short wave diathermy is influenced by option A, Grotthus-Tappers law of absorption, option B, inverse square law of divergence, option C, Arnold-Schultz law of dosage, option D, Lombard's cosine law of reflection. And the answer is option A, Grotthus-Tappers law of absorption. Now let's move to question number 28. The following is true about interferential therapy (IFT). Option A, frequency of 0 to 10 Hz stimulate the motor nerve. Option B, higher frequency stimulation activate A delta and C fiber. Option C, autonomic nerve are not affected by IFT. Option D, useful for pelvic floor re-education. And the answer is option D, useful for pelvic floor re-education. Now let's move to question number 29. The following is not a contraindication of lower level laser therapy. Option A, malignant lesion. Option B, metal and plastic implants. Option C, epileptic patient. Option D, overthyroid gland. And the answer is option B, metal and plastic implant. Now let's move to question number 30. The order of sensation experienced with an ice water bath is option A, burning, aching, cold and numbness. Option B, cold, aching, burn and numbness. Option C, cold, burning, aching and numbness. Option D, aching, burning, cold and numbness. And the answer is option C, cold, burning, aching and numbness. Now let's move to question number 31. The range of pressure exerted in the limb compression using a compression garment varies between option A, 1 to 30 mm of mercury, option B, 10 to 80 mm of a mercury, option C, 1 to 10 mm of mercury, option D, 80 to 100 mm of mercury. And the answer is option B, 10 to 80 mm of mercury. Now let's move to question number 32. Contraindication for ultrasound application includes all except option A, ischemia, option B, over spinal cord after laminectomy, option C, over electronic implant, option D, enthesitis. And the answer is Option D, endocytes. Now let's move to question number 33. The following is true about non-contact low-frequency ultrasound. Option A, application technique is dynamic. Option B, applicator is kept very close to the treatment surface. Option C is usual mode of pulse ultrasound technique. Option D, delay wound healing. And the answer is option A, application technique is dynamic. Now let's move to question number 34. Which of the following is not true about continuous passive motion? Option A, effective and safe means to mobilize joints. Option B, less effective in initial post-operative phase. Option C, motorized device more through a present range. Option D, provide a stimulating effect on healing of tendon and ligaments. And the answer is option B, less effective in initial post-operative phase. Now let's move to question number 35. Which is not true about extracortical shockwave therapy? Option A, indicated for chronic tendinopathies. Option B, local or intravenous analgesia often required. Option C, better results when done under image guidance. Option D, stimulate healing process in delayed or non-union of fracture. And the answer is option C, better result when done under image guidance. Now let's move to question number 36. Which of the following exercises increase the heart rate and arterial blood pressure with the rise in pressure related to intensity of exercise? Option A, isometric exercise. Option B, isokinetic exercise. Option C, isotonic exercise. Option D, none of the above. And the answer is option A, isometric exercise. Now let's move to question number 37. Bridging exercise is not useful for option A, facilitating pelvic motion. Option B, strengthening of the low back extensor. Option C, strengthening of hip extensor. Option D, strengthening of hip flexor. And the answer is option D, strengthening of hip flexor. Now let's move to question number 38. Normal capsular pattern observed in shoulder joint is option A, medial rotation, lateral rotation, abduction. Option B, lateral rotation, abduction, medial rotation. Option C, abduction, lateral rotation, medial rotation. Option D, lateral rotation, medial rotation, and abduction. And the answer is option B, lateral rotation, abduction, and medial rotation. Now let's move to question number 39. The technique used in treatment of rigidity of Parkinson's disease is option A, repeated contraction. Option B, slow rehearsal. Option C, rhythmic initiation. Option D, rhythmic stabilization. And the answer is option C, rhythmic initiation. Now let's move to question number 40. Heart rate reverse method to calculate the target heart rate is called option A, Frank-Sterling's method. Option B, Humphrey method. Option C, Cowen's method. Option D, flexibility exercise. And the answer is option C, Cowen's method. So that's all for today in part 2. If you need clarification for any of the above questions, do comment below in the comment box. I'll be happy to help you. See you in the next part, that's part 3. Bye bye.